going to talk about GERD. GERD is treated as gastroesophageal reflux disease. What is this diagram? This is GERD. You see this? You see all these lines? This line, this is stomach acid. So, you see this sphincter that is called the LES. The LES or the lower esophageal sphincter. This LES prevents the acid from flowing out and only of food going in. When the acid tries to escape, when your food goes in, the LES sphincter is like an inhibitor for these acids. It closes when acids try to escape and opens when food comes in. This is a healthy stomach. You see this acid bubbles up in the stomach. But you will wonder, why does the stomach eat itself from the inside out? It is because your stomach has wrinkles. The stomach has cells that is arranged in a wrinkle pattern that gives an advantage for less of the cells to be exposed to acid. And also those cells won't degrade though. It's because the cells are designed to hold acid. So there's a tube connecting this giant bag of acid to our mouth. And this is what we call the esophagus. The esophagus is the part that connects your mouth and your stomach fleshy bag of acid. For like a one-way valve, food comes in but doesn't come out. It's because of this critical muscle valve. You may ask, how can a valve affect your whole upper digestive tract? Yes, it's because if this LES sphincter weakens like this, strictures will happen in this, leading to Barrett's esophagus, then leading to squamous cell to adenocarcinoma, which is basically esophageal cancer. And also the problem is, this disease will make your esophagus, this one-way valve, into a two-way valve, like we see in our circulatory system. Sometimes acid and food may go to critical points, like the mouth. This causes regurgitation. The same thing emperor penguins do when they're starved of food and have nothing to feed their chicks but regurgitated food from their esophagus. Thank God we don't live lives like that. So, when this happens, there are ways to do this. There are ways to diagnose if you have this disease. There are three ways. The first one is the upper GI endoscopy. In this upper GI endoscopy, you are given anesthesia and then a tube is inserted through your mouth and into your stomach and to the point where the LES is. That small tube has a little camera in it, which takes photos of the LES and will show if the LES is incompetent or closed, according to the symptoms. If you have the symptoms of GERD, an upper GI endoscopy will be taken to make sure if you have GERD. Symptoms of GERD may be a heartburn. If you go to your doctor and your doctor says your heart is alright, it might be GERD. Second one is a barium meal. You ask why we have to take barium as a meal. It's because doctors have been using barium to find out problems in the digestive system. Once you swallow some barium, a doctor will put a tiny camera just like the one in the upper GI endoscopy and take pictures of the barium and display it on a large screen to see if there is really a GERD or are people just having symptoms we normally have in GERD. Then the third one and most delicate is the 24-hour pH monitoring. So now let's talk about the symptoms. The symptoms include heartburn. Etc. So now let's come to the causes. Causes might be drinking too much alcohol, tea, coffee, and other things. If you are in a mild stage of GERD, your doctor may prescribe not eating coffee, alcohol, and many other beverages. So, precautions are taking less stress in your work, avoiding meals 2 hours before bed, not eating spicy foods, not eating oily foods, etc. So, now your stomach is a precious organ. Don't waste it in the name of acid reflux. Thank you.